Great Yarmouth ranks highly as a popular UK seaside destination, but overall health of local residents rates quite low, with the Great Yarmouth and Waveney Primary Care Trust finding that 1/3 of the population eats less than one piece of fruit or vegetable a day, often opting for junk food instead.
It is quite a poor area, you know, there does seem to be a real need actually for some real positive health promotion work to be done in the area. On the marketplace itself, we have about 9 chip vans and 2 fruit and veg stalls, which I think really sums up the area, quite honestly.
Striding along a Norfolk beach is a great way of keeping fit. Nordic Walking says this group is gentle but effective. This class is sponsored by the Great Yarmouth and Waveney Primary Care Trust, and it's helping many get back on their feet.
I've had a cardiac event, a triple bypass, and this is helping me sort of get my fitness back.
The PCT says this coastal area needs these schemes. Men in the poorest wards here have a 23-year difference in life expectancy from women in the richest, and those in need are the hardest to reach.
But for the PCT to be able to address these issues, they've had to understand what the major problems are and where they occur. So they've mapped mosaic household data to provide this information.
2 years ago, we did our own research to find out where the greatest number of people live who are at risk of heart attack or stroke. The dark areas have the highest risk and the light areas the least risk. This is a map of those who are least likely to eat one piece of fruit and veg per day. The red areas match those areas with the highest risk of heart attack or stroke.
From this information, a route was designed to link the most at-risk areas. This route is for the innovative mobile food store, a 3-year pilot partnership project between the PCT, a community organisation called Community Connections, and a local fruit and vegetable wholesaler.
The project is supplying fresh fruit and vegetables, providing the van to facilitate that, and get fresh fruit and vegetables into areas which otherwise wouldn't have access to them. With the demise of the local shops, people now have to travel to supermarkets. Not everybody can do that. So we felt this was an opportunity to take fresh fruit and vegetables to the people. We feel that in our long-term interest, for the future generations, this will be the way to go.
It's not for profit, so customers are ensured of a good deal. And for those eligible, they can also use their Healthy Start vouchers. Overall, it will make a real difference to users' lives.
At the moment, I work. My daughter's at nursery. Sometimes it is quite hard, obviously, getting to the shop on time and getting the fruit and veg for when she's at home. At the moment, I'm just giving my daughter burger and chips, which isn't really healthy for her. So with the convenience of the van, then I can start giving her healthy food, and also they will help me how to prepare it for her.
69-year-old Colin Orr leads a Yarmouth Tai Chi class sponsored by the PCT. It says he's a good example of the benefits of healthy living. As it takes proactive healthcare out into the community, this PCT hopes it will soon have the fastest improving health in England. A cookery class at the mental health charity Mind. People with mental health problems are usually really hard to reach, but the PCT says its community nutrition team is getting the healthy eating message across. The students are picking up new skills and ideas. Just one initiative, says the PCT, that's touching parts of the community left out in the past. Great Yarmouth and Waveney PCT has many initiatives to bring healthcare out of the surgery and into the community. It's spreading the message of how important it is to eat well and exercise regularly.
The purpose of this programme is in order for you to become more healthy.
Some of the work is done one-to-one. This is a pilot project to target diabetics. Linda Mee has type 2 diabetes, and working with nutritionist Lisa Lorenzen, she's found new ways of managing her condition.
I'm quite pleased. I've lost weight off the tops of my arms and my legs, so I'm really pleased. I've gone down from a size 24 to a size 18.
Helen Munford was concerned about her 10-year-old daughter's weight and attitude to food. Working with health trainer Eliza, they're now equipped to make and maintain changes to Charlotte's diet.
Charlotte now gets involved with what we are going to have for dinner. Eliza has taken her food likes list and suggested menus for us, so we can then all have food that Charlotte likes and we like. So that's how it's worked. So it's been absolutely fantastic. It really has. It really has. It's changed our lives.
All of the skinny kids used to take the mick out of me and say, "Hey, look over there, there's Big Faye." And I was just like, I used to sit in a corner by myself and just stuff my face.
I've been big most of my life, and I used to get bullied quite a lot. But since I've been doing the mend, I'm not getting called fat anymore.
The MEND programme isn't a diet, it's about a lifestyle change, a healthy lifestyle. And the children, the programme is delivered in the community where the children are living and going to school. It's a family intervention and they're able to maintain it, and it's great to see the results.
Well, as a specialist sports college, we're very keen to promote activities which lend themselves to healthy living and promote active lifestyles.
A similar project to MEND was established in Great Yarmouth. It was launched here at Fitness 2000 and it's aimed at reducing adult obesity. It's a good example of partnership with the private sector.
This private health club received government funding to install a sport wall. Essentially, it's a giant computer game, but one that encourages strenuous participation and makes fitness fun. Long-term weight loss is achieved by combining this type of exercise with nutrition advice. Whether for adults or children, the success of weight management programs in the Great Yarmouth and Waveney area are proving that partnerships work.